At this moment, we would like to continue with the closing ceremony of this forum, and in this opportunity, the official launch of the Brazilian campaign for breast milk or human milk donation in Brazil. In this solemnity, the Minister of Health of Brazil, Dr. Marcelo Queiroga, the President of Oswaldo Cruz, Olivia Trindade, the Director of the Brazilian Agency for Cooperation, Ambassador Rui Pereira, the representative of the PAHO in Brazil, Dr. Socorro Gross, the representative of the UN Fund for Children, Dr. Cristina Albuquerque.
The floor is yours. Thank you so much. In fact, I am the coordinator of the healthcare department of UNICEF, and I'm representing Florence Bauer. I'm representing Dr. Florence Bauer. I would like to greet all the officers and government officials here on behalf, and also the Minister of Health. And I would also like to greet our sister agency, PAHO, but I'm breaking protocol. I cannot manifest myself for the admiration, my thanks to Dr. João Aprígio, this person that has been fighting for many, many years on this topic. And he is my guru, he is my mentor. When we talk about human milk in Brazil, and in international terms, human milk banks. He is the one who represents that. And I would like to start restating that breastfeeding is at UNICEF's DNA. And we have been following up in terms of global terms. And UNICEF in Brazil has been paying attention to the evolution of breastfeeding and, as a consequence, the milk donation. Yes, the milk donation in Brazil. Recently, we had a national survey that brought the new data about breastfeeding, exclusive breastfeeding for 6 months here in Brazil, exclusively, and as a complement until the 3 years of age.
Ainda mais, né?
There has been progress, there have been advancements, but we still need to improve, mainly because of the pandemic. Breastfeeding has been well discussed. I'm not going to discuss the benefits. You, ladies and gentlemen, are experts in this topic, but I would like to attract your attention for the situation that we're living now. UNICEF last year in Brazil carried out a study with the Ibope Institute about the second impact of COVID-19 on childhood and on adolescence. And what we noticed was a deep level of poverty, a higher level of vulnerability of the lower classes, classes C and D. And this, of course, brought and brings with it great, huge repercussions when it comes to the food security of these children. Before, here in Brazil, we were working hard in terms of the pandemic of obesity. We know that human milk also has a positive impact on non-communicable diseases and obesity. And now we are facing a crucial moment, and we are seeing more and more families, and it lacks food to them. Food is lacking for them. They are facing food insecurity, mainly the families that have young children. And at certain moments, they don't even have money to buy food. And so breastfeeding at this moment is, it's a very, very strategic and essential element for all women, for all babies, for all families, and mainly for the most vulnerable families. Because human milk, besides everything that we know, it's free, it's free, it's perfect for the child. And so it's important for us to continue letting people know, look, breastfeeding is important, exclusive breastfeeding for 6 months, it's a healthy food. And so research from 2018 give us a sample of the advance and of the enrichment of the industry that manufactures formulas, and they all kinds of substitutes of artificial milk. So it's about 61 billion in sales of formulas and products that substitute milk, but they don't actually substitute human milk. We are facing a huge challenge. The network that we have at a global level is strategic, it's important. We are going to celebrate the 40th anniversary of the code. And here in Brazil, we also have the NBK and its regulation. And it's a very, very important instrument so that we can regulate the aggressiveness, let's put it this way, of the advertising campaigns and also the action of the factories, the companies of the industry that are trying more and more to substitute human milk and breastfeeding. And these commercial pressures are enormous over the families. And this is another topic, a very serious topic here in Brazil. I know that people from IBFAN, they are here. I believe they're here. Please help us monitor the decode, the NBCAL, and also a stronger monitoring, and so all of the government levels, they should monitor the situation so that we can make the decode and its regulation here in Brazil to become into effect, and also IBECAL. And I was also analyzing a publication, a wonderful publication with data. And so we have the HMBs here in Brazil. And so from 2000 to 2019, we had a huge increase in donors of the milk collected, but we still have a lot of room to improve. We also have in Brazil in 2019, 2,849,000 babies that were born alive, and about 53,000, 53 and 600 babies dying during their neonatal days. And so we must move forward in raising awareness on how important it is for the mothers to donate milk, the importance of breastfeeding, because without breastfeeding, there is no extra milk, and involve not only the women. At UNICEF, we have been working more and more the concept of being a parent. And so I'm here to make this appeal, to you. We should involve the families more when it comes to breastfeeding and also regarding the donation of milk. Many families are starving, and regarding this, the solidarity and the donation of milk. Oh, so many people are donating rice and beans, but we cannot find human milk at supermarkets. So my message is congratulations, and I'm really happy to be here. Thank you so much. Thank you so much, Dr. Christina. We apologize, but we are going to have to change the order because of a problem with their schedules. So I would like to pass the floor to the director of the Brazilian Cooperation Agency, Ambassador Rui Pereira. I would like to pass the floor to you. Thank you so much. Good afternoon to all, ladies and gentlemen, to all of the participants. It's a great honor to take part in this closing ceremony of the International Technical Cooperation Forum to celebrate the International Human Milk Donation Day. And I would like to congratulate in a very enthusiastic day the Brazilian campaign for the donation of milk of 2021 that also starts today. I would also like to greet the Ministry of Health, Dr. Marcelo Queiroga, the President of Fiocruz, my dear friend Nisa Trindade, the representative of PAHO, Dr. Socorro Gross, the representative of UNICEF, Ms. Christina Albuquerque, who we have just heard, and all of the people who are following us up all around the world. And I would like to greet also in a special way all of the mothers, donors of human milk, because you save lives every single day, because this gesture is a gesture of love, a gesture of social commitment, of personal commitment. You are donating food and health to those who need it the most, those that are starting their lives. Ladies and gentlemen, so the participation of participants from 30 events reflects the importance that this initiative of the implementation of HMBs has, mainly mainly due to this terrible pandemic that we are all going through, and we had we had no precedent for this, and so it's been hard on the world and on Brazil. And so now we should think about international cooperation because of huge catastrophes and health catastrophes that we are facing. We should strengthen our national healthcare systems, and I would like to celebrate the SUS, the Unified Healthcare System in Brazil, more than ever should become a priority of our international cooperation agenda. And so the Minister of International Relations, Dr. França, mentioned that now we are facing three emergencies: the pandemic emergency, the economic emergency, and also the emergency of having a sustainable development. This was highlighted by the Chancellor, by the Brazilian Chancellor, when he appeared at the Federal Senate. And he said that this is the diplomacy of the healthcare sector. Ladies and gentlemen, the ABC, the Brazilian Cooperation Agency, is the agency of the federal government of Brazil responsible for negotiating, coordinating, following up, and assessing at a national level the technical cooperation for the development, and also the human cooperation that has donation of food, donations of medication, and other essential items to assist the populations that are facing environmental disasters, calamities, armed conflicts, wars, or any other serious crisis, okay, created by the man or by nature. And so we would like to mention the Ministry of Health, that via a very close partnership with the Brazilian Cooperation Agency and the Ministry of Foreign Affairs, has allowed this kind of work of Brazil when it comes to the humanitarian cooperation. Thank you, Minister Queiroga. The technical cooperation is a powerful instrument so that we can develop as nations, and we can strengthen our local capacities. We can offer human resources, strengthen human resources. We can exchange experiences, knowledge, technologies, innovations with other nations, with our friends, other organizations. And so the cooperation agencies that are public or private, all of them are excellent centers and excellent at what they do, such as the Ministry of Health, and as is the Fiocruz Foundation. I believe that the experiences shared by them abroad via the technical cooperation projects have aided other nations to identify problems and find common solutions and wonderful solutions between Brazil and other countries with the support from PAHO, from UNICEF, from the WHO, and other member agencies of the United Nations. Ms. Socorro, and there is a lady that has just arrived in Brazil, and she's going to take over the UN system. I greet you and welcome you to Brazil. A beautiful example of the international cooperation, ladies and gentlemen, is the cooperation developed by Brazil when it comes to HMBs. It's an integrated work between the ABC, Fiocruz, and the Ministry of Health. This low-cost technology, but with high technical level, has caused positive impacts, positive social impacts, and it has been shared with 23 countries in the Americas, with Europe, with Africa. And so it's a success case. It has been recognized by the UN. And this cooperation, this South-South cooperation, has resulted in the diminishing and reduction of the mortality rates among our newborn babies. And nowadays, we have the global HMB network. This cooperation is not only a strategic action so that we can achieve the SDGs of the 2030 agenda of the United Nations that are directly related to health, but also reinforcement to promote food security and also to avoid all kinds of malnourishment. And so we can impact babies' health because we help them when they are just born. And so the HMB network is based on the strict principles that we have in our constitution. And I would like to announce solidarity. This is a principle that we need now, urgently now, because of the pandemic. And so learning from one another, exchange information, respect for nations' sovereignty. We are not going to interfere in the nations involved. That is how the global network works. And so this global network is trying to achieve health for all the nations in a sustainable way. This event asked us, what else can we do? In terms of the global network, okay, we should do more of the same. And I have already said this during the event. Everything that has brought us here now, many years after we started this project in Brazil, when we launched the first HMB in 1943. And so on behalf of ABC, I am here to renew my commitment that we are going to continue building innovative solutions so that we can overcome these terrible barriers that have been placed in front of us because of the pandemic. And we're going through this pandemic with our valuable friends and partners. Okay, and I'm very happy to say this, and I'm proud to say this, that the Ministry of Health here in Brazil, Fiocruz, and the WHO, and also PAHO. Thank you so much for your attention. Thank you so much for your attention and patience. Thank you. At this moment, we would like to pass the floor to the representative from the Pan American Health Organization here in Brazil, Dr. Socorro. Dr. Socorro, the floor is yours. Good afternoon, ladies and gentlemen. I would like to greet the Minister of Health of Brazil, Dr. Marcelo Queiroga, the President of the ABC, the Brazilian Cooperation Agency, Ambassador Rui Pereira. I would like to greet the President of Fiocruz, Dr. Nisa Trindade, and also Ms. Cristina Albuquerque. that is ahead of UNICEF. And so it's a great honor for us to take part in this forum because we had many experiences that were exchanged. Mainly today, date on which we celebrate the World Human Milk Donation Day. And so may we be able to leave this event with a lot of new knowledge and with all the synergies and energy of each one of the people who contributed so that we can continue with this beautiful task of protecting and helping develop our babies and promoting breastfeeding in all parts of the world. This is our mission. And so
nos tirar de nosso caminho.
And
Sabemos
so we know that breastfeeding is and it will always be one of the most important in interventions and one of the healthiest in terms of healthcare in our children and the mothers and the parents.
So breastfeeding gives us the hope for a better and healthier future for all children and communities of the world. We know we have the work to guarantee that our children can breastfeed and many lives are saved. And I like to thank once more the help from the network and the child and the teenage Fernando Figueira, and also to thank Dr. João Aprigio, and an honor to have the Institute Fernando Figueira, PAHO, and the World Health Organization. It's a reason to be proud, and breastfeeding that be done in the region of the Americas and of this great country with the commitment, with the health and well-being that you have. Certainly, we will live in a better world. And from the part of OPAS or PAHO, you have our commitment to this partnership to make potentialize even more these HMBs to strengthen technical cooperation together with the Brazilian Agency of Cooperation and to take more health to our people. I would like to end in this World Day of Human Milk Donation, our admiration and gratitude to all mothers that donate milk and that save a lot of lives. Without you, this wouldn't be possible. Congratulations. Thank you very much. And you can always count with PAHO. Good afternoon. Now we'd like to invite the president of Fiocruz, Ms. Trindade. Good afternoon. Thank you very much for conducting this. I would like to congratulate Minister Queiroga of the Ministry of Health, the director of the Brazilian ABC, Agency for Cooperation, Ambassador Rui Pereira, and Socorro, Ms. Socorro from the PAHO, and Cristina Albuquerque representing the United Nations International Children's Emergency Fund, Brazil, UNICEF. These are sister organizations to greet all participants of this forum for technical cooperation for the donation of human milk to dispense the lessons learned during the pandemic. It's a great satisfaction to be here with so much apprehension in this scenario, which is unusual, and to bring the word of Fiocruz as institution, which is the National Institute for the Health of Women, Teens, and Children, that we are very proud of hosting this center for breastfeeding and milk donation, like Dr. Socorro Gross mentioned. And it's a reinforcement of a commitment where I would like to thank all participants in the name, in the person of João Aprígio, which is not only a friend, but like Cristina Albuquerque said, is someone that symbolizes, it's a great leadership of this work. And it's leader because he knows this is only possible in a network. That's been the view of Fiocruz and part of the Ministry of Science and Technology as well. So in a few words, I would like to thank all donators of human milk. I think this is a moment of thanking, especially in hard times. We know that in times of pandemic, other health actions are harder to be carried out, and therefore one more reason to be very happy about the realization of this forum. Human milk has been well put, and always hear João Aprígio mentioning this, is the first vaccine that the child receives. So in this moment where we're dedicated to the vaccine, to the immunization, that will allow us to overcome this sanitary crisis, always to remember of human milk as this essential vaccine for humanity. It's the first vaccine. And also to remember the role that the Human Milk Bank has had in reducing mortality in the 2030 agenda objectives, and also it's very glad to carry an event like this where everybody is discussing the possibilities of setbacks on that objectives due to the impacts of the pandemic, so that we strengthen this agenda. It's very important, the presence of the institutions represented and of those that collaborated, representatives of institutions of 30 countries that made this 3 days, a lot of reflections, proposals, so that we can continue in this path, one of the most productive in international collaboration. And one of the great satisfactions was to go to Mozambique and to see the impact of this project, to go to Angola and the capital Luanda and seeing the implementation of the Human Milk Bank and all of the work being carried out in Latin America and Europe, because this is a work that should be advanced all over the world. And many times our countries are examples what the country should do. So with those words, I'd like to leave my greetings and our commitment from Fiocruz with this very important agenda and work, and this important network of work and international cooperation. Thank you very much. At this moment, we would like to invite the Minister of Health, Mr. Marcelo Queiroga. Your Excellency has the floor. Good afternoon to all. I'd like to greet Ambassador Rui Pereira from the Brazilian Cooperation Agency, Dr. Socorro Gross, representative of PAHO and WHO in Brazil, Ms. Cristina Albuquerque, which is coordinator and representative of the UNICEF in Brazil, and Nízia Trindade, president of the Oswaldo Cruz Foundation, and João Aprígio, of the coordinator of the Human Milk Bank Network in Brazil. My friends, this is an important day and the Ministry of Health of Brazil supports this initiative in a very determined way. Breastfeeding in itself is already an act of love. The donation of that breast milk is twice as much an act of love. So to all mothers that donate their milk to help those kids that need it the most, my greeting, my recognition, and in name of the Ministry of Health, it is necessary that all of us are united. Besides recognizing this initiative, that we stimulate that it be even more amplified. It is fundamental for the health of our kids, and those that invest in kids invest in the future. There's no doubt about it. That's why the Ministry of Health, and I ask for your attention for a video of our campaign that gives incentive to the act of sharing human milk. Open letter from a mother to a mother. To be the mother of a baby is to know unconditional love, to know a new level of wariness, but also of affection, is to smile together, cry together, and take naps together, to feed, care, worry, to become an emotional once more, even during the pandemic, to help other mothers with premature babies and that needs that mother's milk. So this thanking in the form of a letter is for you, you who donates hope, a great gesture that can save the life of those that need it the most. If you can donate mothers, if you can donate breast milk, do it. Any quantity can make a difference. May is the month of the mothers, and mothers are synonymous of breastfeeding and of love. And this day is the National and World Day of Human Milk Donation. Brazil, as we've mentioned various times, is international reference, and has one of the greatest networks of world. We want to increase these initiatives. 222 HMBs all over our states, and 220 collection points all over the country. The numbers of donation is still very low as regards to our demand. That's why in days like this, it's very important to us. From January to December 2020, 290,000 liters of human milk were collected. 182,000 women donated human milk. To those women, our thanks. 157,000 liters of milk were distributed. 212 newborns were benefited. This represents 64% of the real need for human milk in Brazil. When compared, the volume as compared 2020 compared to 2019 show a 2.7% increase of donation. So even during a health emergency of international level, this pandemic of the COVID, we had 2.7% increase in donations, but it is necessary to advance even more. The pandemic demands that many efforts be done for qualified information as regards the security of milk donations. We've worked day and night to overcome this health crisis, and the proof of this is that we are among the 4 countries that have most distributed vaccines to its population. 90 million doses of vaccine have been distributed since the beginning of our campaign. And we have two national institutions that are public institutions, Fiocruz and the Butantan, that have the capability of producing these vaccines and the main suppliers of vaccines for the national program of immunization. And Oswaldo Cruz Foundation, in the beginning of this semester, has the capability of producing vaccines with inputs that are totally national. But it is a commitment with health, but especially with women, in pregnant women. We know that vaccines, the Ministry of Health, in partnership with the CONAIS and CONASEM, we understood that this was a strategic point, this vaccination of pregnant women, and we will make an effort so that more than 3 million pregnant women, especially those that have have health problems, that they might be benefited with vaccines. And these will be the women who will be breastfeeding their kids and will be donating milk to our milk banks, and in that way helping children that are hospitalized in ICUs, in neonatal ICUs, and to help their recovery. To stimulate this donation and to the benefit of these premature babies or of low-weight babies and those that are in intensive care units, they cannot be fed by their mother, the Ministry of Health launches the national campaign of breast milk donation with the slogan, "Donate breast milk, donate hope." A great gesture that can save the life of those that need it the most. I'd like to thank Mr. Antonio Rodrigues Braga Neto and our Secretary of Primary Care, Dr. Rafael Câmara de Medeiros. And I thank you for the support that you've been giving to this initiative, be in Brazil, be to the various countries in the world. Thank you very much.
Nós gostaríamos de agradecer a presença das
We like
autoridades
to thank the presence of the authorities that much honored our closing ceremony. For final considerations for these 3 days of work, we would like to invite the Global Network, Mr. João Abrijo Guerra de Almeida. Dr. João, you have the floor.
Bom, amigas e amigos, eu acredito que
Friends, I think that in terms of final considerations, the ambassador, authorities present, Ms. Socorro, President Nisia, Cristina Albuquerque, friends of all countries, countries from Brazil, from the Brazilian network. Just one word to finish. Thank you. Thank you for your effort. Thank you for your help. Thank you for your dedication. Thank you for your support. Thank you for creating this great collective effort to make it in a reality. Our network is above all of network of institutions, but it's a network of people that share an ideal, that believe in a collective way they can change the reality. Thank you very much. Thank you, President Nisia, Socorro, Ambassador, other authorities, and the Minister, Queiroga, of the health. We know the volume of work that you're dealing with due to the pandemic, and that we have a great month, good results, good fruits in our social mobilization and our respective locations, and in our federative units, municipalities, and thank you. Cordial greetings until the next one.
se todos pudessem, por favor, só abrir as suas câmeras para que a gente pudesse tirar aquela foto
If you could
coletiva.
open your cameras so we can take that collective photo, that would be nice.
Perfeito.
open your cameras. Thank you, Gillian. Tanya, Chester. If you could open your cameras. We have a lot of participants through the YouTube, a very big volume. We had 3,600 access through our YouTube channels. 2,000 participants. Thank you, Aeneas. Thank you. Especially you, those who were behind the curtain, so to say. Thank you. Thank you to all. Have a good week.
Podemos encerrar.
Podemos terminar.
Gracias, thank you very much.
Bye, thank you.
Bye-bye.
It's a great event. Great event.
Thank you, everyone. Take care.
Thank you.
Bye. Bye.
Obrigado, Aline. Bye-bye, meu povo. Vontade de ficar aqui, né? Mas...
E obrigado pela oportunidade.
Isso, Vlad, nós que agradecemos aí.
Obrigada, doutor.
Obrigado, Aline. Vocês foram show de bola. E como eu disse para você e para sua equipe, né? Nós estamos só começando. Né? Seguramente, uma série de questões. Semana que vem a gente já começa a conversar novamente. Muito obrigado. Jonas.
Obrigada.
Graça, enfim. A todos vocês um grande abraço. Muito obrigado. E, meu povo, se a gente pudesse dar aquela conversada rápida para um acerto de algumas questões via